Bone marrow transplant unit at Medanta is a state-of-art facility, and it's one of the largest facility available in the country. And as there is a huge need for doing more and more bone marrow transplants in the country, somewhere around 50,000 bone marrow transplants every year are needed. These are the areas when you need to give a new bone marrow to replace the old bone marrow, because the old bone marrow is either has been killed because of chemotherapy or is already damaged because of cancer or some other defects. What exactly is bone marrow transplant or how it is done? So in simple words, any patient who has a bone marrow which is not working very well or has a cancer in the bone marrow, and if we go from the first step, because these are blood disorders where bone marrow transplant is offered, like bone marrow failure, leukemia or immunodeficiency, so you need a good hematology lab which can diagnose these blood disorders correctly, that you have a disease where bone marrow transplant is required. At Medanta has gone to the next level where we can diagnose even the invisible cancer. So once your cancer is not visible under the microscope, blood cancer, we can still detect it with flow cytometry techniques. Then comes various other labs like microbiology. After transplant, your immune system is very, very weak for many months and you are at risk of getting various infections. So it's very, very important to diagnose infections very fast, very quickly with latest techniques, so that we can start treating the patients quickly and save lives. As we enter the facility, first thing we have to do is that it's a strictly access controlled unit. The HEPA filter facility is there in the air conditioning. These are positive air pressure rooms, so that there is no mixing. Even if someone sneezes in the corridor, those germs don't enter the patient's room. And at every step, the whole idea is that when you're entering patient's room, you are not carrying germs with you, and when you're coming out of the room, you're not carrying patient's germs outside and spread to the other patients. So the whole idea is that the nurse is 1:1 nursing, so each patient has their own nurse. That nurse doesn't enter the other patients' rooms, because these patients, when they undergo bone marrow transplant, they have zero immune system. Any bacteria or virus can prove highly morbid and can lead to threaten their life. So that's why all these controls are required, and that makes us improve the outcomes of these patients.